It is now my pleasure to introduce our speaker today. Mr. Raymond Barrett, CEO of the Telehealth Certification Institute, is a licensed professional counselor and an expert telehealth trainer and consultant. His passion for telehealth emerged from his experiences as a clinician seeking practical, high-quality telehealth training. He is a frequent speaker of professional organizations, and since 2014, TCI has delivered comprehensive telehealth training and consultation to a global network of more than 26,000 healthcare organizations and professionals. TCI now offers over 90 specialized courses, a vast array of telehealth resources, and ongoing free continuing education opportunities for telehealth providers.
Welcome, everybody, and thanks a lot for being here and joining me in this. I hope you'll find this helpful. I'll tell you a little bit about myself. So I'm a licensed mental health counselor. And when I first started practicing counseling, which was, 18 years ago, my very first client wanted sessions over the phone. So I've been doing telehealth ever since. Started the Training Institute about 8 years ago, the Telehealth Certification Institute. So we provide training and consultation. And what I'm going to cover today is cultural competence specifically for telehealth. And one of the reasons why we talk about this, at least I think, is because when providing telehealth, we often are providing services to clients, patients in all sorts of areas, right? Different communities that we're not familiar with at all. So even if we're providing services to patients that live in the same community as we do, their culture still may be drastically different. But that just gets expanded, right, when we're seeing patients that are not even in our community. So what I'm going to cover is I'm going to just kind of do an overview of some of these main topics. And one of the things is, what is cultural competence and humility, right? And why is it important? And then how do we get a self-understanding or awareness of our own culture? That's quite a challenge, right? Sometimes we need help with that. And then how do we understand our client's culture, right? So first we have to have a decent understanding before we can do something with it. And then we'll look at some disparities in the use of telehealth. And then how is it that we can design technology in our workflows and the services we provide in a way that's culturally relevant to the clients that we're seeing? So let me say off the bat, like, I do not have all this figured out, right? And I think, I try to like research this and study it a lot. And I really think that we have a long, long ways to go in terms of really understanding how to serve people who have all sorts of different, come from all sorts of different cultures. So what to do with technology and the provision of healthcare in regards to cultural competency. I think we have a long ways to go, but hopefully you'll find this helpful here. So cultural humility, what is it? And why is it important? So I think, Hook, right? I think Joshua Hook coined this term in 2013. There's the book Cultural Humility, Measuring Openness to Culturally Diverse Clients. And the way the author defines it is having an interpersonal stance that is other-oriented rather than self-focused. How important, right? So I'll finish the definition in a minute, but I think that's just key. Being other-focused rather than self-focused. That's as an individual, but also as an organization. People vary, right? So it go on saying, characterized by respect and lack of superiority, right? In healthcare, we can identify with that, toward an individual's cultural background and experience. And they show studies that demonstrate the importance of cultural humility. They say that clients' perceptions of their therapist's cultural humility are positively associated with developing a strong working alliance. I come from the behavioral health field myself, right? And we know that the alliance between the provider and the patient is key to good behavioral health services. And of course, right, the client's going to feel like there's a much more alliance when they feel like their clinician's culturally competent. So I'm going to be aware of time here, but I recommend that you take a look at the CDC's definition of cultural competence. And again, just for sake of time, I'm going to skip over it. But they talk about what is cultural and linguistic competence. They talk about what is culture, what is competence. They define what does that look like, and what's the impact. So in these slides, which I'll make available, in maybe you'll get those. I have links to all these resources and definitions. So I strongly recommend that you take a look at that. All right, but basically, cultural competence is being able to effectively work with people and organizations within context, right, within their culture. So here are the resources. One resource is there's a website, Culturally Connected, and there's another one, Standards for Organizations, through the Think Cultural Health through the Health and Human Services. The DSM-5 has a cultural formulation interview, which is super helpful. In terms of training, I took this training myself. It was fantastic. I think it took like 6 hours to go through, but it's provided through Think Cultural Health. Again, it's fantastic. A lot of different modules. I recommend that if you really want to go deeper into this information, I would take that training. All right. So number one, self-awareness, like understanding our own culture and our own bias and privilege is very important. I think privilege is very contextual. So as the provider in your community, in your office, with your clients, your patients, how is it that you experience privilege and what are your biases? That's very important. So how do you do that? I think we need some real help with that. But in terms of research, does having bias have any impact on healthcare? Like, can I have biases, but it not actually impact the care that I have? The studies have found that there's a positive relationship between the level of implicit bias and lower quality of care, right? And again, you can look at these resources to see the data. So how do you like get an idea of what are your implicit biases? You've probably heard of this self-assessment, and I recommend that you take it if you want to start kind of looking at what are your implicit biases. It's the implicit association test, external website policy. So that's a good place to start. Just the fact that we are a provider, right? We have provider, client, provider, patient relationship automatically puts us in a position of power with that individual, right? We're the ones that went to school and learned about different diagnoses and diseases and treatment and so forth. So being aware of how that comes out in our interactions with clients and patients is really important. And getting feedback can help us make changes in regards to that. All right. So here's some more resources. And again, I'm giving you a lot of resources here, but Multicultural Care, a Clinician's Guide to Cultural Competence. That's where you can take the assessment. Here's the link to Joshua Hook's book. All right, so understanding our clients. How is it that we get there, right? So some of the things that I think it's important to understand about our clients. And by the way, one of the ways we can do this is through our intake process. And I'll kind of look at more, I'll explore more in terms of how it is we can do it. But some of the information we want to get from clients is what's their name and preferred name, right, to be called? What pronouns do they use? What's their race and ethnicity? What's their gender identity? What sex were they assigned with at birth? How might their cultural identity impact their understanding of their struggles and what treatment might be most helpful for them? How might their culture impact their relationship with their clinician? What's their preferred language and dialect within that language? And to get at that, you might ask, what language do they speak at home? Where were they born? Where'd they grow up? What's their role at home? What's their role in their community? And finding out about these things, show an appreciation for the person and value for the person with the role and things that they do in their life. You might ask, who are the most important people to them in their life, right? So just getting a decent understanding of who is this patient, this client that I'm working with? What's life like for them at home and in their culture? So again, during the intake interview, you could get that information. How's that done? It could be done asynchronously, where you can have an online form, right, during intake. It could be done through an intake interview. It could be done during the first clinical visit. And then what do you do with that? So this is where I think we're really lacking with our workflows and technologies. First is gathering the data in a really convenient, friendly way, and then knowing what to do with that data. So again, I think we really need to work on this in terms of technology and what we do with it. All right. So another concept to think about is what's called explanatory models. So this concept was introduced by Arthur Kleinman. And what it is it's how is it that the client understands the problem that they're dealing with? And how do they think they're going to get better? What kind of treatment do they think is going to work for them? Well, how do you figure that out, right? There are some questionnaires, assessments that you can go through with your patients to get a sense of what is their explanatory models. Of course, when you go through med school or nursing school or whatever school you go through, right, you're trained on a certain explanatory model. Okay. So the way we understand struggles, illnesses, diseases, whatever, and what the appropriate treatment protocol is definitely comes from a certain culture and training, et cetera. But we want to be able to partner with our clients and patients on the treatment plan and understand where they're coming from, right? And I mentioned the DSM-5 has a cultural formulation interview, which is another good source. Now, another term, right, in terms of in cultural competency is intersectionality. And what it says is that, people are sometimes discriminated against because of multiple reasons. Again, and it depends upon the context and the environment that they live in, their community. But someone can be discriminated against, mistreated, et cetera, because of their gender identity, their sexual orientation, their socioeconomic status, the language they speak, where they're born, all sorts of things, their race, ethnicity. So people can be discriminated against for multiple reasons. So all these different reasons for being discriminated against could intersect and be compounded. Now, in terms of understanding our clients and what they struggle with in their community, again, we have the client as a source of information there. But there might be other sources of information and understanding our clients or patients when working with them. One is to find out what is their community like? What do they do in their community? What are their activities in their community? You can also use a cultural facilitator. So I'll give you an example. When I moved up to New York State, I lived in the Finger Lakes region in upstate New York, and which is kind of a rural area. And when I first moved there, this was probably like, I moved back there. I grew up there as a kid and I've been away for a while. And I moved back there like 9 years ago or something like that. And I wanted to find out who's doing telehealth up there. And the Finger Lakes Community Health Center was doing a lot of telehealth. And so I did some training for them, and they had a lot of cultural facilitators. And they found their cultural facilitators super helpful because they helped the outside providers understand the client, what was going on with the client, barriers to treatment. The cultural facilitators really understand the clients, and they knew what to look out for, what were the gaps of healthcare, what were the barriers to getting treatment, et cetera. So sometimes connecting with the cultural facilitator can be really helpful. And if you're working with a particular community a lot, say, a school or just a small community, go and visit, right? If that's possible. That's another way. I think the more we can relate to people and understand where they're coming from, the better. So next, I'm going to talk about some statistics and disparities in telehealth. But before I do that, I want to just pause and see if there's any questions or feedback so far, where we talked about what is cultural humility and competency, self-awareness, and then also understanding your clients and patients.
So at this point, Ray, I'm not seeing any questions in the question pane, but I would like to remind everyone, if you do have a question, if you will just type your question in, we will answer those as they come in or as Ray wants to answer those questions. And then if you would like to answer a question out loud, if you will raise your hand on your profile, I will unmute your mic and let you talk with Ray.
All right, sounds good. All right, so yeah, some statistics. So we have some Pew Research studies, and I'm not going to spend a lot of time on this, but actually I'm just going to breeze over it because I want to make sure we get to Q&A and get all this information. But those over the age of 64, right? There's a much smaller percentage of those over 64 compared to the rest of the population that have access to the internet, that have broadband internet, or that use smartphones, right? Now, of course, this is changing, but that's the case as of now. Another thing is income level, right? So those with income less than 30,000, household income of less than 30,000, of course, they have much less access to broadband internet. So there, in terms of just access and the utilization of these basic technology, there's certainly a disparity. Now, in terms of video sessions, so this is just doing, right, video conferencing sessions with patients. There was a study done in 2020, so just recently, and they looked at a whole bunch of clinical visits during 2020. They actually looked at about 150,000 patients. And what they saw was that those of older age, Asian race, non-English language as their preferred language, or if they had Medicaid, they had a lot fewer telemedicine visits that were completed, right? And those that are older age, female, Black race, Latinx ethnicity, lower income also had lower use of video. Okay, so that's just video. Again, in terms of video, another research in 2021, it said that increasing age was associated with higher odds of a phone or incomplete visit. So higher age, they would end up using the phone rather than the video. It says that non-Hispanic Black race is associated with nearly twice the odds of completing a phone instead of video. So you can see the disparities in terms of using video conferencing specifically for healthcare. And again, there's other studies that show similar things, such as in New York City during the pandemic. It said among all telehealth visits, the likelihood of a fully audio-video telehealth visit was reduced for patients who were older, Black, of urban areas, or who were self-pay or Medicaid or Medicare, right? So that's just with video only, okay? Now, in general, for telehealth, this study was in 2021. Now, this covers both asynchronous and synchronous. It covers phone, video, secure messaging, etc. What it showed was that Black respondents were more likely than whites to report using telehealth. Now, I got to tell you that these percentages were really close, but it showed that Blacks were more likely to use telehealth in general, remember, than whites. And why is that? Well, this article, what they are thinking is that the systemic racism created systemic racism in healthcare created this disparity where Blacks were more likely to go to telehealth than go in person for treatment, right? So it's hard to tell the cause and effect, but that's one of their assumption in this article. So they're showing that telehealth is a good solution to help overcome these barriers and disparities. So another study, this was in 2021, they found that patients with limited English proficiency had lower rates of telehealth use, right? So why? Well, maybe it is that they felt like they wouldn't be able to be understood, that the communication barriers would not be overcome through telehealth use. All right. So some of these other ones I'm going to skip over again, just for sake of time, but we don't have much time here. So now we understand that there's disparities in healthcare, there's disparities in telehealth. So what is it that we do about it? Like, how do we make a difference here? So one thing is in terms of access to technology, there's disparities, as we covered. There's also some disparities in terms of what you'd call digital proficiency, okay? So what I'm providing here for you is some really good resources to point your patients and clients to help them overcome these disparities. They might not know about the resources available to overcome these things, right? So people might be able to get access to internet or devices for healthcare, or training on how to use the technology in the first place and get comfortable with it. So there's a lot of resources out there to help us with these things. So in telehealth, as a provider, I think we should see ourselves a little bit as a navigator, like understanding someone's culture, understanding their familiarity and access to technology to be able to get access to the services that we are providing through telehealth, which is only going to expand more and more, right? And then getting them connected with the resources to overcome those barriers. Again, people just might not know that they're available and how to access them. So here's some really good resources for you without going into what they are. All right, so another thing is, how do we adapt the services that we're providing so that we're being culturally relevant to the clients and patients that we're seeing? What does that look like? And I think we have a lot of work to do here. Okay, a lot of work to do here. If you look at healthcare, when I look at healthcare, like the major companies of healthcare and even telehealth, it's pretty, things are presented on the website and so forth that seem to be pretty generic, where they can fit everybody. The images used, the text used, there's actually usually very little images used. So when we as the providers, we're going to talk about developing technology to be culturally relevant in the ethical dilemmas that come about there. But then even just when we're actually providing services to clients, how do we adapt it for that particular client or patient's culture? So again, I come from the behavioral health world. I'm a behavioral health clinician myself, right? So I'm going to use behavioral health as an example for you, okay? So this website, Embrace, they have resources about how to talk to kids about race, right? So if I'm working with a child who I believe does experience discrimination, or their family does, or they feel like they don't fit in because of their race, this website is great, provides awesome resources that they're able to relate with. This other website, I'll actually show it to you. This is actually developed by one of our instructors for some of our courses. And it's just full, tons of resources of how to customize behavioral health treatment for people of different races. And here on the column you could see Latina, Black, African American, Asian American Indian, LGBTQIA plus. And it has just videos and books and activities and all sorts of stuff. They did a fantastic job. I know Richie Rubio did a lot of the development for this site. Assessment tools, school-based mental health, et cetera, et cetera. So I certainly hope you check out that resource. And then there's other resources. So another one is an example, is this organization, I'll let you see it here. This organization, a lot of their clientele are seniors, okay, older adults, and they provide behavioral health treatment. So they customized and they only do telehealth, by the way. So they customize their services for older adults, for seniors. And they have a really cool process. I can't remember exactly, but it's like a 4-stage process of getting their older adult clients activated in terms of being social. So they have like these online games and resources, and then they have groups, therapy groups for seniors, and then they have one-on-one therapy, and they set the stage, they set the environment, the virtual environment specifically for seniors. So you'll see here they have self-help virtual rooms, and this is their senior room. And it's so cool because you can click on any of these objects. So they'll make this available to their senior clients, and they can go here and they can like play poker, they can go fishing, they can click on here and it will take them to the old shows that they remember, right? Just a lot of really fun things that seniors will be that a lot of seniors would enjoy. Now, again, whenever we do this is what I find to be the ethical dilemma, is when we customize our services or technology for particular cultures, are we stereotyping? Are we only providing certain services or providing services only in a particular way to people according to their culture? And is that okay, or is that not okay? So, when we develop technology, often there's biases built into the technology. When we design workflows and services and et cetera, there's often biases built into that. So I'm gonna get into, well, how is it that you try to mitigate the risks of the negative impacts of this customizing the delivery of service or technology? But this is certainly something to consider. But I think this is really helpful. So here are some other resources in terms of behavioral health, right? So like there's a book, Barriers to the Use of Telepsychiatry. And this is recent, 2019. I'll get my little pointer here. So if you're in behavioral health, I'd take a look at that. And it's really interesting because not only do they talk about barriers to telemental health treatment for telepsychiatry, but also what you can do to overcome that and what do you do with it. And then there's another very recent publication article in 2022, Adaptation Models, Barriers, and Facilitators for Cultural Safety in Telepsychiatry, right? So there's articles, there's resources, there's websites, et cetera, for how to be culturally competent in the delivery of services. So I'd recommend that you take a look at that for your own particular healthcare field. All right. So I'm just going to pause for a second just to check in with you, Sherry, to see if we have any comments or questions.
We do. We have one question and one comment. So we'll start with a question. And this is from Astrid Wilkie McKellar. And Astrid asks, what are some examples of work of the cultural facilitators?
What are some examples of what?
Work of the cultural facilitators. And I'm
Okay.
guessing she's wanting to know kind of specifically what would a cultural facilitator do, maybe on a day-to-day basis, what would their work look like?
Yeah. So I am not the know-it-all when it comes to that, because I have not worked in a facility where we had them, but I visited and talked to facilities that have them. And what they do is they are part of the care team. So they're assigned clients according to the client's culture, the culture that they're familiar with. Let me give you an example, and I don't want to misspeak for this organization, but the Finger Lakes Community Health Center, again, this was years ago that I talked to them. But just as an example, they have a lot of migrant workers in that area that migrate up to pick fruit and stuff like that. And many of them are Spanish speaking. So they'll have culture facilitators that are very familiar with that culture in that community. And what they'll do is they will make sure that those patients are actually getting to their appointments, that they understand the treatment, like they understand the treatment plan, that they understand it, that it's going to work for them, and that they understand what their diagnosis is, that they are connected to the providers that they need to be connected with. And then let's say they don't show up. Well, first of all, a lot of times they call before the appointment to make sure, like, okay, so you know when your appointment is, you know how to get there, you're able to get there. But then if they don't show to their appointment, they contact them and they find out why, they find out what's going on. Sometimes they'll even transport the client to their sessions. So it's kind of like you have, if you traveled, I don't know that this is a good analogy, but this is what popped in my head. If you travel to a new country where you don't speak the language, you really don't fit in culturally, and you're going to a hospital, how nice would it be to meet someone who really fits your culture, who understands your dialect and understands you and how things make sense to you, to kind of be a little bit of an in-between. So sometimes the cultural facilitator, they will hear from the clinician that something's not working out with the client, and then they will contact the client, the patient, to figure out what's going on here. So there'll be kind of an in-between between the clinician and the patient. Does that help? And I'm sure some of you on this call might have even more information on how that works, but that's my understanding.
Thank you, Ray. And there is one comment over in the chat. This is from Teresa Williams, and it's not really a question, but I like her comment, and it made me start thinking about the work that we do on a day-to-day basis. And that's around rurality. So her comment was that, sometimes people in rural areas have very poor or little or no access to broadband or, smart devices or, whatever it may be. When we're talking about cultural competence, we're thinking about urban and suburban populations as compared to rural populations. What does cultural competence look like when you're talking about geographic differences?
Yeah, so I think in terms of geographic, you have urban and rural, but urban and rural, this is one thing this is what I always go with is to look at the individual. So when we talk about urban and rural, I live in a somewhat rural area now, but I know a lot of people that moved from big, huge cities. So like I live right now, I live in a somewhat rural, and in the community I live in is extremely diverse because I live in a place where there's a university. So people come from all over. So I know that's not directly answering the question, but what I would say is I think it's important to understand the individual themselves, because someone might live in a rural area and they might be a farmer who, they like spend their time shooting guns and taking care of their cows, and they don't have internet and they rarely, go to the city. Then you might have someone living in a rural area where they're constantly on the internet and they might be a web designer. So yeah, but but there is definitely, in terms of access to internet, issues in rural areas because it's not set up yet in some areas. So that's certainly a barrier. But that's one thing I would do is look at the individual themselves, and other people might have good advice. But in terms of disparities and what do we do to address it, people might think differently about this, but there are petitions to the government to expand broadband throughout our nation. So actually, the American Telemedicine Association, the ATA, currently, right now, if you go to their website, I think it's right there on their homepage, they are advocating for people to petition for broadband throughout the United States, which would help people in so many different ways. People use it for employment, for getting employed, for doing their job, for going to school, for getting healthcare, for getting everything, right? So that's one thing we could do.
Thank you, Ray. I would like to remind everyone, I don't see any more questions in the Q&A panel. If you have a question, please just click on the Q&A button at the bottom of your screen, type in your question, and we'll be happy to get that taken care of for you. And if you would like to speak with Ray personally, just raise your hand. There's a raise my hand button on the bottom of your screen in Zoom, and we'll unmute your mic and you can speak, or you can always just type something in the chat. We have about 4 minutes until the top of the hour, so I wanted to give just another second or two for any questions to come in.
Okay. And I'll move on with content. I definitely have more content. All right. So using technology to provide access to culturally relevant treatment, right? So the first thing that we want to do is get data. Okay. So again, we talked about, understanding their demographics and their culture and their interests and their preferred communication style and all this kind of stuff. How do we get that? So like when I say preferred communication style, do they like to send messages like secure messaging or video or phone, or do they like to come into the office? What barriers do they have to treatment? What's their access to technology? What's their digital or health proficiency, right? These kind of things. So where do we get that information? We have surveys, we have the client portal, we can use apps, we can do intake calls, during the clinical visit. The other thing is technology. So we want to find out, do they have access to the devices? Do they have access to the internet? Not just the internet, but is it broadband? And if they do have access to the internet, do they have to pay for that internet according to the amount that they use, right? Because that could be a barrier in of itself. And then is their internet reliable? Also, in terms of text, we should have our, things written in the fifth grade ability or lower. Accessibility on our website. Our website should be friendly to screen readers. Sometimes people use plugins so that people can easily make the font bigger and get contrast and stuff like that. And then what type of technology do our clients use, right? What do they use on their daily basis mostly? Do they do the text or the calls or the apps? Do they use computers or email or a client portal? So in terms of technology security, texting is not secure by any means, okay? But a lot of providers are sending things through text, standard old text, even links to clinical visits, because they know that's the only way that my patient knows how to get access to the video meeting is if I send a text with the link, right? So there's sometimes is a tension between really good technology and high security versus what is the client and patient actually going to utilize, right? So understanding what they use is important. And then telehealth might not always be a fit for the client. So getting that information is important. Another thing is the development and design of the technology in the first place. The terms used for this, there's tons of terms used for this, right? It's user experience design, it's human-centered design, human-computer interface, all sorts of things, right? But the idea is like, how do we design technology that's going to be super user-friendly and culturally relevant to our patients? That's a whole field of study. So in terms of the design, how do we do that? How do we make it applicable to our patients or clients, right? When you purchase a platform, a platform for your whole healthcare system, right? An EHR with a patient portal, many of them allow you as the provider to customize the interface yourself. Now, when you do that, often you can customize what the interface looks like for the clinical staff, the support staff, the admins, the patients themselves, et cetera. But think of this. If you have a platform that allows the patient to design the interface for themselves, so they get to choose what shows up when they log in. They get to show up what resources are available, right? All those kind of things. So they get to design their own interface that meets their needs. They get to see what's all available and what do they want to utilize. Another thing to think about is using AI. And again, I think there's a lot of, again, ethical issues that can come into play here. But if you think about like Amazon and Google and any big good company, right? How do they customize their website for you? Right? They gather data according, they look at your utilization of their site, and they look at the your utilization of a lot of sites, but let's just look at, they look at the utilization that you have of their site, what you're interested in. And then they feed you those things that they know that you're interested in, right? Now, should we do that or not in healthcare, or to what extent? I don't know, but that's another thing. So what can be adapted on the site, right? And again, I think we're getting much better at these things because there's just more resources available. But the images that come up on the site, the language used, the terms used, the resources used, recommended services, etc. So right now, in terms of like development of technology, there's actually not a whole lot of regulation around this when it comes to being culturally relevant. And there is bias in the development of technology. There's examples of this in the past, and I'm not going to mention the companies and stuff like that. I don't want to shame them. But they've seen that, oh, wow, this big company, this particular app definitely has a cultural bias to it. But then when the company finds out, they do, at least these examples I've read about, they do work to remedy those. But when we have machine learning and AI, remember, the underpinnings of that are developed by human beings with bias. So we need to consider that and try to safeguard things. Now, how is it that we do that, right? Here's a publication where this author wrote out guidelines for developing artificial intelligence-based healthcare tools, right? And I really like their principles. So, and it's a lot. So one is to establish an ethics-based governing principles, right? So what are your principles? Number one, do no harm. You want to look at what information is being collected, how is it being used. The other thing that they mention is establishing a digital ethics steering committee. And you want that steering committee to be a diverse group. You want someone in these communities, you want it to be patients, you want it to be, right, just diverse. not just the experts in technology itself. So we can go on and on and on. You want to do tests, right? You want to test out the technology. You want people to evaluate the technology. You want to monitor the technology and so forth. So I would recommend looking through all these steps if you're in the process of, if you're involved in this field at all in terms of developing the technology. But it also might make you look at, okay, so if I'm purchasing technology that has all this great capability with AI built in, it supposedly it supposedly adapts my platform for the culture and ethnicity and preferences of my patients. You might ask, like, where were the safeguards in the development of this technology when it comes to culture? Who was involved in the development of this platform, where there was someone that was really kind of the ethics police, in the development of it. I think that's important. All right. Let me just pause for a second, see if there's questions before I move on.
There are a couple more questions, and it's around data collection. Typically in an organization, should there be one person or maybe a small team of people that's responsible for the communication with the patients? And maybe that goes back to the facilitator we were talking about earlier. And how are you collecting data to screen for patients who may be appropriate for telehealth versus those patients who may not be appropriate? So what kind of points of data are you looking at to make those considerations?
Yeah. I think this is probably going to evolve rapidly over time. So one thing might work for an organization now. It might, one thing might work for a particular organization, depending on what their patient population is and where they're located. And then, a year from now, it might be different because people are more used to using technology for healthcare. But one way to do it is in your marketing. So letting patients know what's required in order to receive a service in that particular way, right? So if you're doing video conferencing, this is how it works. This is what you're going to need to have. Another one is when you do the intake, if you're doing intake where it's where someone is sent to, say, a client portal, or they're sent a text where they click on a button that takes them to a client portal and then they're filling out a survey. That's another way of getting the information. Another one is through an interview, right? Someone calling them, or when the person is first calling in to schedule the appointment. So like for telehealth, some things you're going to want to find out is, if this, let's say they want a video session, or you're scheduling them for a video session, do they have a private, safe location, like environment, where they're not likely to be interrupted? Where will that be? Because you need to know where they're going to be in case there's an emergency, right? I mean, in behavioral health case anyway. You want to let them know the states, because in the United States, we have licensure laws. Isn't that fun, right? So you want to make sure they understand that they need to be in the particular state where the clinician is authorized to practice. Have they used video conferencing before? Are they comfortable with it? Let them know how they're going to access the video conferencing system. And you could even have them do it while they're on the phone with you to test it out. Like, okay, so you're going to be sent a link. I'll send you this link now. Did you receive it? Can you click on it? Do you see where to get? So if you send someone to a client portal and you say, hey, here's the link to the client portal, or you don't even give them a link. You say, go to our website, click on this button on our website, register on our client portal. Are they going to do it? Maybe, maybe not. But if while you're on the phone with them, you walk through it with them and have them do it right there and then their likelihood of utilizing and feeling comfortable with technology is going to go a lot better. Another thing about this is, do you assume that the person is comfortable with using your technology? So someone could be an IT specialist it doesn't mean that they're not going to want help hand-holding to getting set up with using your technology. So I think it's always good to ask. So if it's an intake call, can we spend just a minute now for me to walk you through getting onto our client portal and sending your first message to your provider, or getting logged in and seeing where you go exactly to access your session. So I'm probably giving you more information than what that question asked. But I think in terms of getting the information from clients about their culture and access to technology and digital proficiency, it can be done in different ways, automated on a platform or through an intake interview, either way.
We have one more question. Do you know of any studies, and this may be a little too soon because I feel like we're still in the throes of COVID a little bit, but prior to COVID, when there wasn't as much utilization, and now post-COVID or during COVID, while there is great utilization of telehealth, are there any comparative studies regarding cultural competence and compliance with medical care, whether cultural competence is lacking perhaps in an in-person setting versus cultural competence that's lacking in a telemedicine setting, versus those settings where cultural competence is highly regarded and is a part of the repetitiveness here, the culture of that organization. So do you know of any comparative studies there?
One, and I can't quote it exactly, and I can't remember which article it was, but there was a study done during the pandemic and getting assessed for COVID in New York City. And I hope I'm quoting this right, is that there was something to do with when you compared blacks to whites, people, right, colored skin, when they came to the facility on site, they were assessed differently than when they were assessed via telehealth for COVID. So what the study was showing was that there was some bias going on there where people were being screened, assessed for COVID differently in some regard when they were being assessed, screened on site versus telehealth based upon race. So again, I don't have the article right in front of me, but that's the only one that I'm aware of that would speak to that. Sherry, let me move on just for a second, just because I know you have a few minutes. So in terms of solutions, right? One thing that's really important is literacy. So in language, so I talked about the literacy a little bit. The language, of course, using language lines, using translation services, all of these things are improving a lot. And when you look at websites, they usually don't have a lot of options in terms of the language the websites can be in and so forth, but I think that's getting better and better. When you use a translation service, interpretive services, I mean, you want to make sure that the translator and that the patient really feels understood by the translator, because just because they speak the same language doesn't mean they speak the same dialect. So that's one thing that's important. And again, for sake of time, I'm gonna move on. Another thing to look at is your policies. So when someone asks like who does it, who does the intake? Well, staff need time. They need time to assist clients with technology and training. So the staff need to be trained. They need to understand how to walk patients through the use of technology and help understand their culture and overcome barriers. Involve staff in the selection of technology. Have a statement on your website and train staff on cultural competence. In terms of assessments, assessments in themselves have been tested and normed and so forth using particular cultures, right? And then your treatment style, the way you've been trained, like in behavioral health, we have all these different therapy styles and modalities. They were developed by people of certain cultures and tested, right? When we talk about evidence-based treatment, well, the evidence is based on particular cultures and races, right? So do any modifications need to happen there? Maybe or may not. It might just be modifications in the delivery of the service. So again, I have a lot of resources on the slides. I will make those available.